What we do with Perfect White Smile is we've been very good at treating patients with TMJ type problems. And we are sort of anti-medication, anti-Botox. We feel that those can help, but they're just masks over it. We actually get to the core. It will diminish indefinitely. We do that by structurally and functionally changing the location of the jaw. The teeth and the jaw joint are on the same bone. So what we do is we find a sweet spot, we say a balance, an equilibrium, some sort of harmony between the joint, the bite, and all the muscles. How do we do it? We work backwards. We first relax and calm down all the muscles. We use medical instrumentation to help guide us. We use EMG sensors, very sophisticated instrumentation. We're not just guessing. And we actually get everything calm and relaxed. And when we have it calm and relaxed, we say, where's the lower teeth? Well, they're over here. Well, if they're over here, then let me take an impression of that, and I'm gonna build your new bite plane into that position. And that is gonna maintain the calm muscles and a nice joint that opens and closes with the disc over it. And so we actually put you in this corrective physiologic position, and all of a sudden patients say, you know what, my headaches are gone. Oh my God, I don't have that neck tension anymore. I can feel the pressure is gone on my neck, the back of my head. I feel so much better. The facial pain has diminished. It's incredible how many patients report relief of symptoms once we find this harmony position that is physiologic. I use the word physiologic because what that means is that we're really getting to the muscles. A lot of dentists don't really look at muscle data, which I find a little off in the sense that we are working in this jaw joint that has at least 4 big muscles that are attached to it. They call them muscles of mastication. If you're working in an area that has 4 slings of muscles attached to it, wouldn't you want to see some data of what's going on? So we use these things called EMG sensors, stands for electromyography. And what it is like a Richter scale. If the muscles are really active and upset, you'll see like a high Richter scale. If the muscles are nice and calm and relaxed, you'll see like barely anything. What we're saying is that low activity during rest is probably healthy. High activity is not healthy. When we say we're finding harmony with the muscles, the jaw joint and the bite, we're actually really finding that harmony. We look at data on the muscles and make sure it's nice and calm, and that's where we put you. We take a 3D x-ray called a CT scan. A CT scan is just an x-ray that can see in 3 different views, X, Y, and Z. And I'm able to circle the whole joint. I can measure to see how much space there is between the jaw joint and the skull. And we know we want at least 3 millimeters. So if you have less, we know it's a problem. I can also see the shape of the condyle. It's called the condyle, the jaw joint, the little ball that goes up and down. So I can actually figure out if it's being worn or eroded or it's like under pressure, so that we know that we have to move the bite position in order to create more space there to allow the disc just roll up and down freely with the jaw joint as you open and close. When we find that harmony position, we place it in something called an orthotic. An orthotic is the positioner that holds you in that nice harmony position. We don't like when patients take it out. We want it in permanent. And the reason why is we give this analogy that just pretend you had a bad knee and you said, hey doc, I can't run with these crutches and the splint on my knee. I gotta take the splint off to run. That would be like eating. Hey doc, I can't eat with this. Every time you take it off, your joint's gonna go back to its bad position and you're gonna promote that pathology that's been going on up to this point. So we like to tack it in, and it's a fixed orthotic, meaning it doesn't come out. We also give a night appliance to hold you there while you sleep. We do everything we can to calm the system. And we have a very successful technique on the protocol, how we put these patients in. We don't win all the time, but we win most of the time. I like to tell patients we win 80% of the time, but it's probably a lot better than that, because I want patients to know that they're owning up to their problem and I'm there to help them with their problem. I'm not a salesman. I can't guarantee that I'm going to definitely get you out of pain, but I can really use modern, sophisticated instruments and techniques and my experience of 33 years as a dentist to do everything in my power to get you out of pain. Stop your headaches, stop your neck pain, stop the ringing in the ears, the fullness in the ear, the facial pain. We work on every aspect. We look at your neck on that CT scan. I can tell if you have a good neck or a bad neck. We look at your airway. We can tell if you have room to breathe and if your tongue is in the right position or not, whether it's where it should be or whether the tongue is weak and falling into the throat space. We can see all that. And so we can really get to the core of your problem. So I take a CT scan, I take pictures. Right away, I know what your problem is. Trust me. I'm going to tailor your treatment towards you and your problems that you have. So it's not like a factory where everyone's getting the same exact thing. Everything's tailored towards you and your own problems. That's how we treat patients with TMJ, and that's what separates us from just someone who just throws a mouth guard in. We're not masking over with Botox or medication. We're not injecting into the joint. We're not doing surgery. We're allowing your body to heal on its own and to figure this out and get healthy. That's how we do it here in Beverly Hills at Perfect White Smile.